Kia ora. Welcome to Naturopathy with Bridgitt at Radio Kidnappers in Hastings. Thanks for taking the time out for listening today, and I appreciate you getting some good feedback from listeners and from the videos that I'm popping up on my webpage and Facebook page. So thank you. Today I am talking to you about urine infections and cystitis, and there are many reasons for urine infections. I am a qualified naturopath and medical herbalist, and I have a natural health clinic called Maintaining Your Health, Whakatika Oranga, and it's based in Napier, Hawke's Bay, New Zealand. So welcome. I offer a free 15 minutes chat on 027 284 3781 to see how you can find out how I can help you find balance with any of your health issues using natural health solutions. Okay, so urinary tract infections. There are many causes for it, and I'm going to talk about the physical causes, and I'm going to give you some tips and some advice and tips of the day, so Ken will remind me at the end of tip of the day. So, urinary tract infections mostly affect women, but it can affect men as well. And the symptoms that most people are experiencing is all of a sudden it comes on out of nowhere, and it's this urgent need to go and urinate. And when you do urinate, it's this burning, stinging pain that happens, and maybe only a little tiny bit of urine comes out. And so this burning, stinging pain gets worse and worse and worse as the day goes on, and maybe keep you up through the night weeing. You may experience lower back pain, you may experience some kidney pain in the back, in the flanks on both sides. And if you don't do anything about it, then maybe you just might experience blood in your urine, and that's when you really do need to maybe go and see the doctor, get some antibiotics, and knock it on the head. So today I'm here to help you to try and deal with it as soon as it comes, instead of going down the line and getting antibiotics. Okay, so some of the reasons that you could have a urine infection are sexually transmitted diseases, poor hygiene. So when you go to the toilet, maybe you're wiping, for women, you're wiping the wrong way. Maybe you're wiping front to back when really we should be wiping front to back. Ken's laughing because I've got it mixed up again, but it's your toilet hygiene plays a big part as well. Sometimes if you have diabetes, this can contribute. If you're on immunosuppression medication, this can have an effect, create urine tract infections. Sometimes pregnancy can, and sometimes when you have a change in sexual partners as well, or a new sexual partner, this can create friction, which can create urine tract infection. And if we're using maybe new laundry powder, or for women you're dousing below with some lovely flavoured or chemical fragrant products, that can irritate the acid alkaline pH as well. Oral contraceptives can create urine infection, and of course heavy antibiotic use can as well. Maybe if you've got an obstruction in your urethra, now that's a new word for some folks, so that's the tube that connects the bladder down into the exit area, so that's the urethra. Maybe there's some stones, kidney stones, or there's an obstruction, or maybe a physical obstruction. Maybe if you've had a urinary tract infection maybe 3 months ago, there might be still some bacteria lurking in there waiting for some triggers to feed it, and off it'll go again. Maybe you've had catheterisation when you've been in hospital, and that's created, it's not been so hygienic, and that's created a urine tract infection. And medications as well as anti-inflammatories can create that as well. So also adding to that list is, I've just let you know, I've just come back off holiday and I experienced a urine infection. So many of us folk have been on holiday, and maybe you've just out of routine. As simple as that. Maybe you're out of routine, you're on the road, you're travelling a long time, a long distance, you're not drinking as much water, maybe you're drinking other liquids, not so much water, and maybe you're not going to toilet as frequently. Going at least once an hour will empty the bladder, so there's no backup of bacteria. So when there is a backup of bacteria into the bladder, this can encourage the bacteria to grow and form a urine infection. So going to the toilet a bit more frequently. And maybe you're not eating as well when you're away on holiday. So it all adds up to a combination of maybe your whole system being acidic instead of alkaline. And so I experienced that. So I'll talk to you a bit more about what I did to help me while I was away. Okay, so we've talked about signs and symptoms. Sometimes you can get a bit of pain or cramping if it is quite severe with the urine infection, and sometimes your urine can smell quite strong, so keep an eye on that. Have a little look at your urine. What colour is it at the end of the day? Is it yellow? Because it should be very light coloured. And does it have a strong smell, like a sweet smell? What does it look like? Is it cloudy? Because when it's cloudy, that can signal a urinary tract infection as well. Let me just look at my notes here. Let's see. So what can we do? What can we do about these urine tract infections? So the first thing is to try and stop that burning when you urinate. A lot of people go and grab cranberry juice from the supermarket, and I go, no. Cranberry juice, true cranberry juice is very, very bitter. So it's not sweet. So if you go and have a look, turn that bottle around and have a look on the back. And normally says about 30 grams of sugar per serving. And sugar will feed the bacteria, and it will not eliminate your urinary tract infection. So cranberry is really important, but not that juice from the supermarket. So you can go and get, dried cranberries. Again, it's the sugar. So we need to lower the sugar content that you're eating. You could go and get maybe Cran Cleanse from the pharmacy that has cranberry and other nutrients in it. Or you can go and get products off the shelf, natural health products, that have cranberry in it. So I definitely would not advise you to have cranberry juice from the supermarket. Keeping your sugar low is really important for eliminating bacteria. Drinking lots of water is really, really important. And I've talked about water before, but water is really necessary for urine infections, for keeping it alkaline and flushing through that bacteria and making you go to toilet more frequently. So keep your water going at least, 2.5 to 3 litres of pure water, not wine, alcohol or coffee or tea. Water will do the trick. Or herbal teas. Herbal teas do count as water. So making sure that the foods that you eat are alkaline as well. All the goody Christmas foods and that you had on your table over Christmas and New Year's maybe, they are quite rich in acidic foods, and they're also quite rich in, they're yummy, but they're rich in sugar. So all those rich foods, they turn your system into acidic. So you need to make your system more alkaline. Okay, so drinking, if you can't get cleanse and you're out camping or you're way up where you've got no access to pharmacy, you can look in the cupboard, look in someone's cupboard, and most people have baking soda. Baking soda is really good for alkalizing your urine, and it'll stop that burning feeling when you have to wee or urinate. So having about half a teaspoon of baking soda in a large glass of water and drinking that, and just keep doing that throughout the day, that will help that will help decrease that burning system. Also, should I say that? Yes, I will. So going back to the STDs, and we talked about the sexual activity, urinating immediately after sexual intercourse will also help to cleanse that whole area of any bacteria that may create a urine infection as well. And reducing, we've talked about reducing all the goody foods as well. Okay. Right. So what I did was I went into the cupboard and I found some baking soda. So we've talked about that. But that alkalinized the urine. But what could I do? What else could I do? I was miles away from the pharmacy. So I looked in the fridge and there was some corn on the cob. I went, okay. So as a medical herbalist, I know that corn silk in a tincture form is a really good urine antiseptic, and it's really good for helping. So I shucked that corn, and it's that yellowy silky stuff at the top of the corn, not the dark brown stuff, but the yellowy silky stuff. So I pulled that off, a couple of corn, and then I made a herbal cup of tea. And I drank that as well as my baking soda throughout the day and the next day. And you know what? It did the trick. It did the trick, and it kept it at bay. So if you're stuck in the area and you've got no help, look around you. Have a look. See what's in the garden. See what you can use. It did come back because I was on holiday and I wasn't being my good naturopath self. So I was walking in the bush. I thought, what else can I use? Okay, I've still got a little bit of baking soda. I've still got the corn silk. So what else can I use? So I had a look around me and I saw some karamu. So that is a Māori rongoa herb. And I picked a few of those. And I also saw manuka. So manuka is just everywhere. So you can just pick. It doesn't have to be in flower. Mine wasn't. And I picked a small branch. Of course, I thank the karamu and the manuka for their herbal medicine. And I made a cup of tea out of those as well. So the manuka was an antiseptic. And the karamu is good for any urine, anything in the urinary system really, bladder, urine infection. So that was really helpful to me. So I made a cup of tea and I drank that as we travelled around. So there are some really good tips that you can do. You don't have to rush off and have antibiotics. So when I did get to the pharmacy, we got into a town, then I brought Cran Cleanse as a backup, and that's great because that has baking soda in with the cranberry, which is a high dose cranberry. So what's so great about cranberry? Okay, so cranberry has this action where it grabs onto that bacteria and it takes it out of the system through the urinary tract. So that's why it's very good, not the liquid in the supermarket. So other urinary herbs that I have in my clinic in cup of tea form or herbal tincture form are buku, so that's really good. That's an antiseptic, just like the manuka was antiseptic. Some other seed that you might have heard of is cleavers, like Bridgitt. So it's a diuretic, so it's going to make you wee. So it's very good for helping pass that bacteria. And again, we've talked about corn silk. So it is a diuretic, and it's a demulcent as well, which means that it helps soothe that tract. And couch grass, good old good old cooch. Who knew that cooch growing in your garden is a urinary herb? I forgot that actually because it was growing rampant where I was staying. But good old cooch grass helps soothe the inflamed tract as well. So, but the main herb is Cretiva nuvula. So that's really good if you've got kidney stones as well. You can use that. Dandelion leaf. Good old dandelion. I've talked about dandelion before in my talks, and it's a diuretic. It's also high in potassium. Echinacea, so that's really good as a immune antibiotic, and it helps with the infection as well. What else could we get here? Hydrangea. So who knew that hydrangea? Again, I forgot. I'm reading off a list. So hydrangea, you know, that's quite an old-fashioned flower, and that's in many old homes' gardens as well. So a hydrangea is a diuretic, anti-inflammatory. So this is what I mean. Look around where you're staying. Have a look in the gardens. Marshmallow leaf is a really good demulcent, so it soothes the tracts. Olive leaf. Are you staying where there's olive trees? That's very common now, olive trees. So you could just get those, crush the leaves, make a cup of tea. Add it to the corn silk maybe, if you've got that. And stinging nettle, nettle leaf. You've heard me talk about nettle all the time. So it is anti-inflammatory as well, and it's alkalizing. Romania and uva ursi or bearberry is very good urinary antiseptic, antibacterial. So we want to kill off that bacteria as well. What else do I need to talk about? So we've talked about your diet. We've talked about all the physical things, and just before I finish, I'm going to talk to you about the emotional connection, because as you're aware, I'm a holistic naturopath, and it's not only a physical reason for an imbalance, there's also a mental emotional reason, and then there's the top level as well. So most urine infections, the emotional connection is, what are you annoyed at, or what are you peed off about? A situation or a person or something that you have no control, and you have to swallow that down because you feel you have no control of the situation. So that is that emotional connection that ripples on down into the physical. Yes, there's also the physical, you know, you weren't drinking enough, you weren't eating well, you weren't going to the toilet enough, but don't forget the emotional connection with that, really important. Have a think. What is annoying me? What's really peeing me off? How can I change that so it doesn't happen again? So that's Bridgitt. So that's Bridgitt. So tip of the day is Alkalize with baking soda if you've got it. It's cheap as chips in the supermarket. Take it away with you if you're going away camping or you're going away just for on a holiday. It's always great to have it as a backup. Cran Cleanse, you can get that from the pharmacy. Go and get that as a backup. Have it in your bag. It's always, these are little tips to stop you, to prevent you having antibiotics and from it getting worse. Drink lots of pure filtered water. Herbal teas act as water as well, and remember corn silk from the corn if you get stuck and you're out, because corn's really good in summer. Most people have corn. If you're walking in the bush, there's manuka or karamu. They're great antiseptics, and karamu is great for the whole urinary system. So if you would like to chat to me, Bridgitt, to see how I can help you with urine infections, there are all types of urine infections. You can phone me on 027 284 3781. I do have a Facebook page, www.maintainingyourhealth.co.nz. I am on Facebook, I'm on website page, and I'm also here on Radio Kidnappers, and I'm sure Ken and Jill can help you find me if you need to. So there you go, folks. Stay safe, be kind to everybody, and drink your water. Kia ora.